Today we are going to learn about the topic of anemia. So first of all, we will define what anemia is. Anemia is defined as a state in which the level of hemoglobin in the blood is below the normal range approximate for age and sex. The normal values of hemoglobin are different in males and females. If the hemoglobin level is less than 13.5 gram per deciliter in males, then the person is said to be anemic. Similarly, if the value is less than 11.5 gram per deciliter in females, then that female is probably considered anemic. Coming towards the causes of anemia, there are two main causes of anemia. First is decreased or ineffective production of RBCs in bone marrow. It could be due to the following reasons. Number 1, lack of vitamin B12, iron or folate deficiency. Number 2, bone marrow hypoplasia, which can be congenital. Number 3, bone marrow infiltration as seen in leukemias. Number 4, renal failure. Renal failure causes anemia because of the inability of kidneys to produce a hormone called erythropoietin, which is essential for the production of RBCs. And last, anemia of chronic disease, which refers to having low level of RBCs as a result of autoimmune disease or other chronic illnesses. The other causes includes the peripheral causes, which are extensive blood loss, hemolysis, and hypersplenism. Hypersplenism causes rapid and premature destruction of blood cells, causing anemia. Moving on to the signs and symptoms of anemia. Symptoms of anemia includes fatigue, breathlessness, palpitations, headache, ankle swelling, and worsening of ischemic conditions such as angina. Signs of anemia include tachypnea, tachycardia, raised jugular venous pressure, ankle edema, postural hypotension, and flow murmurs. Types of anemia. Anemia is classified into 3 types on the basis of mean cell volume. First one is microcytic anemia, in which the mean cell volume is less than 76 femtoliters. Examples include iron deficiency anemia, thalassemia, and sideroblastic anemia. Second one is normocytic anemia, in which the mean cell volume is normal, ranging from 76 to 96 femtoliters. Examples include acute blood loss, anemia of chronic disease, bone marrow failure, renal failure, hemolysis, and pregnancy. Third one is macrocytic anemia, in which the mean cell volume is more than 98 femtoliters. Examples of macrocytic anemia are vitamin B12 or folate deficiency, alcohol excess or liver disease, cytotoxics such as hydroxycarbamide, myelodysplastic syndrome, marrow infiltration, hypothyroidism, and antifolate drugs such as phenytoin. Diagnosis of anemia. Anemia is diagnosed on the basis of blood hemoglobin level. In order to identify the cause of anemia, further investigations are done, such as iron studies, reticulocyte count, peripheral smear, vitamin B12 folate levels, and bone marrow biopsy. Lastly, treatment of anemia. Anemia is managed according to its types. If it is severe acute anemia due to blood loss, then blood transfusions up to 80 gram per liter is needed. In chronic anemia, we treat the underlying cause. And if anemia is associated with heart failure, then transfusion is vital. Along with that, packed cell volume, and 10 to 40 milligrams of furosemide is given.